Hey everybody, welcome to Ask Dr. Testosterone, starring Dr. George Touliatos, brought to you by his books, Bodybuilding, the Good, the Bad, and the Ugly, and his newest book, Training, Supplementation, and Nutrition in Bodybuilding. It's available now on Amazon.com, and I should be getting mine in the mail very soon, very soon. Please welcome from Athens, Greece, Dr. George Touliatos. How are you, doctor?
Hi, Ron. The book arrives tomorrow, so I'll mail it to you, and I guess you're gonna have it by the 10th of the first week of July. I'm sorry. Yes.
So you've been back in the gym 2 weeks now, right?
Yes. Yes.
How much weight have you put back on?
It's about 5 pounds or more. Yeah.
Okay. How much weight did you drop over those 99 days?
It's 15 pounds.
Oh, wow. Okay. So you already got 1/3 of it back. That's pretty good.
Yeah, I want to, do it step by step and gradually. It's a rebound also, but I want to do it gradually in order to avoid some fat gain.
Right. And, you were careful. You advise people too about be careful when you go back because people are still just getting back to gyms here. And if you try to do everything all at once, you're probably gonna get rhabdomyolysis and end up in the
First
hospital.
week was horrible, it was horrible. I was staying in bed and sleeping all the time, eating plenty of food in order to recover, but it was horrible.
Yeah.
Horrible.
Every body part sore all the time.
Hmm?
Was every body part sore like all the
Yeah,
time?
even
Ow,
my
ow,
arms,
ow, ow.
my arms, my lats, of course, my glutes, my thighs. Come on. I couldn't stand on the toilet and take a crap.
Oh, yeah, it's rough times. All right, doctor, we got some good questions from the viewers. Let's get to them. Number one, what is the right time to introduce SERMs in PCT, and how long should we take them?
It's after the HG. I don't recommend it alongside because SERMs and HG work for the same result through different directions. So SERMs stimulate GnRH and LH that elevates testosterone, but HG downregulates GnRH because it's synthetic. So one after the other, we can use 2 weeks or 3 weeks at the most, some HG at moderate dose, 1,000, 1,500 for 2 weeks every 3 days, and then we can introduce low dose of SERMs. I don't recommend high doses of SERMs like 100 milligrams. Both tamoxifen and clomiphene, and we can also taper them down, so perhaps 50 and 20 or 25 and 10, and then gradually lower the dose, but 2 or 3 weeks also because they have some side effects in the vision, blurred vision, and some moodiness in the mental sphere, because they mess up with the estrogens in the brain. And of course, with PCT, you need time. Time is a healer. You cannot just push buttons. I want this up now. You have to wait at least the time you were using steroids. You have to get out and recover.
Yeah. I
Lifestyle
mean,
matters.
it used to be, 12 or 16 weeks on, 12 or 16 weeks off. That's how everybody used to do it until this blasting. Now it's blast and cruise. That's how most people seem to do it now because nobody wants to be off steroids. Steroids are wonderful. So next one. What is best for heavy breathing and safer for the heart between clenbuterol or salbutamol? What medication do you prefer for heavy breathing? So I guess he means this is actually a question about asthma, I guess, right? If he's saying he has actual asthma.
Both of these drugs were made for asthma, but actually salbutamol, which is inhaled in Greece as aerosol spray, is by far safer to the heart and better to the lungs. So it acts locally to the receptors in the bronchi, dilates them, elevates VO2 max, increases breathing, oxygen consumption. That may also lead to fat burning, a little bit of tachycardia, stimulation because of beta 2 blocker, but it's much safer on the blood pressure and on the heart rate. On the contrary, clenbuterol, yet you experience a nasty cervical pain here from blood pressure and tachycardia also. But the point is, clenbuterol hydrochloride is way more effective in beta oxidation and in fat burning.
Okay.
However, you have some trembling on the fingers,
I always did. I was always like this.
Part of the stage. Almost, it cost me in a relationship with a girl. I was eating, She told me, "Are you on drugs?"
And you said yes. She
I
was
was
so
back at, I was 28 years old,
she dumped you because you were on drugs, on
Ah,
steroids?
no, dumb me, I was cheating on her already,
Oh,
but
oh well. Okay, the clenbuterol had nothing to do with that, as far as I know.
if she's so, if some women are so conservative, but they want a sexy body, they cannot accept the fact that you have to do something for that.
Yeah.
Anyway, it's history. Now she never got married. She's 40 years old, and we met in a party, and she was, we had something,
Yeah.
Anyway, forget it. Yeah.
Yeah, I mean, you're in a different situation. You're single, but it's very common.
I look much younger than her now that she's younger than me 5 years, because I was a bodybuilder.
Well, that's what I'm saying. If you're 40, 45, 50 years old and you're a successful man and you've taken care of yourself, you'll get all these women that when you were in your 20s, they wouldn't give you the time of day. And now they're coming at you and they got
Payback time.
kids. They're 40 pounds overweight. They got like 10 kids and they're like, wow, you look great, doc. You've done great. Yeah. Bye-bye now. All right. I want to get to this question because this is interesting because we talked about this with O'Connor a couple of years ago. I want your take. Supposedly, some guys in prison who were giving testosterone injections would rub the injection site for hours so that the peak hits harder and levels drop off faster, so that in essence, they would be getting more testosterone. It was believed the increased circulation caused the testosterone to be released from the depot into the bloodstream faster. Supposedly, they would say, hey, I don't feel good anymore. Doctor would test them, and indeed, levels would be low. Do you think it is possible to shorten the elimination time and increase the peak of a longer ester so it behaves kind of like a shorter ester? Or is that
No,
impossible?
that's too much. It's overrated.
That
And
this won't turn decanoate into propionate if I just keep going like that?
okay, but I think rubbing this place spreads out the compound, so that it can be perhaps faster absorbed, but has nothing to do with half-life. So
Mm,
if you feel sore after an injection, you may rub it with your fist like this,
yeah,
spread out the compound and the oily solution in order to avoid perhaps some kind of looking like an abscess.
right. But does it actually release more of the drug into your system faster?
No, 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 no. It's already spread through the blood vessels, but in order to avoid this lump of accumulation.
Okay. So it does nothing except get rid of a lump. Oh,
Yes.
okay. See, because he was saying that I remember O'Connor was saying these guys would do that to try to trick the doctors into giving in prison because they were prescribed TRT, but this was a trick they would use to try to get more testosterone out of the doctors. They would rub it so that it would spread and get out of their system faster, and then they would try to
Now,
get,
if there's any way to get rid of the drug out of your system is superhydration, overhydration, and very intense exercise twice a day. So
okay.
increased metabolism and diuresis,
Yeah.
like we do for the show, drinking 10 bottles of water, to get rid of the substance. Yes.
Right. This is perhaps the most important question of the week. Hi, George. Excellent information. Thanks. Just out of curiosity, how old are you?
I'm 47. Yes, it's my birthday on Thursday.
Ah, okay.
Yeah, 47. I'm thinking about to dye here some gray.
I'm trying to. Your hair is the shade that your hair is. It's hard to even see what's gray, and it's like a brownish. I don't even know what color I would call
It's
that.
light brown, but I have some grays here.
Yeah. Well,
When I
you can
get
get
to
away. You're a man. You can. It makes you look distinguished.
yeah, when I have to speak on the television, I go to the hairdresser and dye locally.
Oh.
Because I have to speak about anti-aging. I have to look younger.
So anti-aging is all about having some nice dark young hair. Okay. Here's one. In one of his videos, Dr. Rand mentions that adding 5 to 10 milligrams of Anavar to TRT could bring benefits, such as lowering SHBG. Nowadays, perhaps as a result, I see coaches online recommending a 10 milligram dose of Anavar with a test cycle. I'm wondering how exactly this works, what benefits it could bring, and do you believe in this philosophy?
Yes, of course. And actually, Dr. Rand find this way in order to prescribe legally, off-label, of course, but it's among the symptoms of low sex drive then you can administrate the DHT derivative or synthetic DHT, which is stanozolol, oxandrolone, methanolone, drostanolone, and proviron, which is mesterolone. But all of them attach tightly, bind tightly to SHBG and crush it and let more free testosterone to circulate. But of course, you can give masteron and proviron, which are far less toxic than the 17-alkylated drugs. Another way is to elevate itself the testosterone dose. That every kind of steroid will lower your SHBG and elevate free testosterone. This is how drugs increase your sex drive, by crushing on SHBG. But of course, you can use some boron, which is a heavy metal supplement, 3 milligrams twice a day, and perhaps some DHA you can use alongside. But yes, this is a tricky way. And actually, a friend of mine, who is also a reader, has bought my books, told me that Dr. Ran, he was supervised by Ran, yes, and prescribed him Anadrol for the sake of elevated SHBG. Okay, now you can also lower SHBG in case you have some fatty liver or some non-alcoholic fatty liver disease, and by eating frequent meals, because by fasting or keto diet, when insulin and carbs are low, then SHBG elevates.
Okay, cool. Next one is a fertility question. I have a question about guys who are on steroids and plan to have kids. I'm 29 years old, and after years of training without using steroids, I completed my first 2 cycles this year. Both were 600 milligrams of test and 400 milligrams of tren, currently on my PCT for the second cycle. Results were great, and I'm considering using 2 ml of testosterone per week after I finish my PCT so that I keep most of the muscle I gained before running the next cycle in October. Could 2 ml of test per week between cycles shut my natural production down? Should I wait a couple of years if I want to reduce the risk of not being able to have kids? If that happens, is there any therapy to restart the natural production of testosterone? So 2 ml of test per week, let's say it's 2, so that's probably 400 milligrams a week if it's 200 mg per mil. Would that shut his natural production down, first of all?
This guy speaks between the 2 cycles, so he's cruising like this.
Yeah.
So the cycles already shut off the sperm production, lower the sperm production. And then while you're trying supposedly to recover, then you're still using testosterone. It doesn't sound reasonable, you know? So you have to be completely off. On the other hand, if you still want to use it, and then you have to administer HCG and HMG all the way.
Yeah. I mean, that happens. Like you've helped guys have children. O'Connor's had many guys, helped many men impregnate their wives or girlfriends. So it's not that, it doesn't seem like it's that difficult, even for men who have been on steroids for years with HCG and HMG.
But you have to be patient and follow the protocols, and also do not abuse other steroids apart from testosterone. And be patient and have sex intercourse during ovulation. Everything matters. Ask from your girl to not to stand up, you know, because the semen will drop from the vagina. She has
maybe should they go? Maybe they should hang upside down? No.
Yes, this is also correct.
I have one of those tables at home. You know, that's possible. The inversion table for your spine. Yeah.
She has to lay down, you know, not go to the bathroom.
Oh boy. Okay. Yeah, because you might urinate out the sperm, right? Oh God, what a show. Here we go. I've just added 100 milligrams deca bought from a pharmacy here in Greece, so it's legit, to my 250 milligrams of test E per week. So he's doing 250 tests and 100 milligrams of deca. Should I expect any gains with that small amount of deca? It's the first time I use it, and I've already experienced some very mild depression. I have to add that I completely stopped my AIs, even though I'm overweight, after watching Dr. T and Anabolic Doc being against them if there are no side effects from higher estrogen. So 100 milligrams deca per week, is that enough for gains?
With 250 testosterone, yes, they can work in a while.
Okay.
Better than nothing, of course, but they can give him something, you know, perhaps in 3 months, yes, 12 weeks. It's definitely anti-catabolic effect. He may notice some getting jacked in the gym, Of course, it's not a serious anabolic dose, like 500 testosterone and 400 deca. But usually the ratio should be twice the testosterone than deca.
So yeah. So if he's doing 250, you should be on at least, or the deca should be half of that or less, which he's doing.
Yeah. Yes.
Okay.
For the sex drive.
Right. You don't want that deca dick. Nobody wants deca dick. Okay. Can you please describe how to lower hematocrit while using test? Is there any place for cardiologic dosage of acetylsalicylic acid, 75 milligrams per day, for example?
Yes, this is aspirin. We use it precautiously, but aspirin doesn't lower hematocrit in first place. What it does is deactivating platelet aggregation and preventing clotting. Now, aspirin directly may lower hematocrit by small bleeding in the GIT, in the stomach or in the intestines, and this then has a slight dropping effect on the hematocrit. And also, you can, for the same reason, you can use fish oil, DHA, EPA, omega-3, polyunsaturated fatty acid. But the drug that works is an antidepressive drug called losartan. You can use it at night because if you use it in the morning, especially summertime, you're gonna feel kind of drained and perhaps faint, But losartan is promising to lower hemoglobin and elevation of hematocrit. I've used it during the quarantine and it was promising, yes. Of course, there is another toxic drug, hydroxyurea, which is used under cancer, that you have super elevated kind of leukemia, for the erythrocytes that has horrible side effects. But phlebotomies or blood donations are another precautious, thing to do. But if you overstimulate your bone marrow by sucking blood, it's going to have the opposite effect and rebound. So the system will kind of notice of anemia, and they will start boosting new production. So take it easy. Do not do it less than 8 weeks, 2 months, the shortest period,
Okay, cool. Next one is, what's your opinion about this cycle? Weeks 1 through 4, it's going to be 500 milligrams test and 200 milligrams deca. Weeks 5 through 8, 1 gram of test, 400 milligrams deca. Weeks 9 through 12, 1.5 grams of test, 600 milligrams deca. Is this pyramid dosage a good strategy?
This is the pyramid, okay? It elevates gradually. The point is, the third stage is way too much drug, and it will be stuck in your butt or in your delts, and then you're going to have developing abscess. Also, notice that the side effects gradually will elevate. The blood pressure will elevate, the hematocrit, the estrogen production, I don't know about the rates. This is something optional, but you're going to suffer as you go. Of course, you're going to have the positive effects, but also the side effects. And then I'm not sure if all of this drug is utilized, is absorbed from the receptors. And then, you have to taper down. When you hit a peak, then you have to go down. You shouldn't cut it in cold turkey.
Yeah. I mean, I've always felt, and this is just my bro science way of thinking, if you take the same dose for 12, 16 weeks and then and you stop, it builds up in your system for so long, you're really on, if you're like on testananthate and deca, let's say, and you stop it, you're still on, those drugs are still in your system for 3-4 weeks at least after that anyway. So it tapers off by itself. You don't have to do anything, basically. Okay. Next one. You get a lot of questions from Greece. You have a lot of fans in Greece, and sometimes I just like to say these names because they're so cool. This comes from Eleftherios Chatsoudakas. Is that right? Chatsoudakas. Dr. T and Ron, I'd like to hear your opinion about carb cycling versus constant high carb diet for muscle building. Is it a good idea to follow a carb cycling diet when we try to increase muscle mass? 2 to 3 days per week, we're in a caloric deficit, low carb days. Could it negatively affect the whole process, or would the high protein intake ensure constant muscle growth? Carb cycling for bulking, muscle building.
I mean, carb cycling, the keto cycling diet, the keto cycling keto diet, was the anabolic diet by De Pasquale, was an anabolic kind of keto diet So Monday to Friday was low carbs, very low, and then during the weekend you were boosting carbs, and this elevated insulin. Then you had kind of anabolism, and then from Monday you could do a good workout, but then go down. But this was about fat burning and controlling weight gain. Now you cannot cycle the carbs when you want to have a muscle gain. You know, you have to keep you have to push it always up with the carbs. And insulin and IGF-1 also, that is the result of also of insulin. When the liver releases IGF-1, then also the pancreas releases IGF-1. No, I'm sorry. When the liver releases, when you shoot GH, then the liver releases IGF-1, but also it's also the result of carbs, not just protein, the IGF-1 elevation.
Yeah.
So it doesn't sound reasonable to cycle your carbs. You have to your carbs to be high enough, you know, 500 grams a day, perhaps. Jay Cutler was going 1 kilograms of carbs every day, you know.
Yeah.
Said his rice machine was working 24/7, you know. White rice, you know, fast carb.
Yeah. There's a newer bodybuilder from Canada, Ian Valliere, big guy, and he's doing the same thing, like 1,000 grams of carbs, and he did that in the off season. He was staying very lean.
You have to burn them. You need. This is a fuel, of course, but you have to constantly burn this. Otherwise, it will be converted to fat after glycogen store. You know.
Right. Yeah, that's the only thing I would say to this person. If you have issues gaining body fat, you probably want to eat less carbs on the days you're not training. But for most people, you do want to keep that steady.
There's another opinion about this. Now, for instance, let's say that during the weekend you're not training, and on a Monday you want to hit the legs, which is really hard workout. Are you going to deplete those days before?
Yeah, it's tricky.
Yes.
Yeah, I remember, Evan Senapani years ago, we had this discussion, and he said, why would you take the carbs down because on those non-training days? Because you're still trying to recover and grow every day, even if you're not training. So
you want to refuel your stores, yes.
So keep them in there. I do it because I'm older and I don't need as many carbs as I used to, but
yes,
I'm not a young person still trying to gain, 20, 30, 40 pounds of muscle like this guy might be.
As we get older, the pancreas also doesn't respond the same, and then insulin resistance develops.
Yeah. Don't I know it? Here we go. If I take 125 test enanthate every other day with proviron and zinc, should I use an aromatase inhibitor also? I'm only doing this for 5 weeks. I'll use orals before and after those 5 weeks.
Zinc has slight antiestrogenic activity. It does. And it's a supplement. Of course, it doesn't substitute aromatase inhibitor. Beautiful. What's his name?
Branch Warren. Well, it's not Warren. It's named after Branch. Get down, dog.
What kind of dog is that?
He's a boxer, plot hound, Chesapeake Bay Retriever, pit bull. 4 different kind of dogs.
He kissed you on the face, eh?
He's a good boy. He wants his walk. But yeah, so I'm sorry. So zinc, you were saying, has a mild antiestrogenic property?
Yes.
Okay. Yeah, he didn't say what he's doing for the orals, but he's only worried about taking aromatase inhibitor while he's on test.
It depends on the orals, if you use aromatizing ones or non-aromatizing.
Yeah.
Depends on the orals.
I mean,
Diana and the Anadrol, they do aromatize, but Muscular and Anadrol do not.
So I guess his question is about the test. So 125 tests a week, every other day, comes out to roughly, it's about, what's that, about 500 a week?
Yeah. I think you need
roughly 500 milligrams.
3 milligrams of anastrozole at least, I believe.
Okay. All right, next one is another cycle question. Shocking. After my heavy roid cycle, I'm on a cruise of 200 milligrams test sip, 100 milligrams deca, proviron, and HCG. My blood report is PCV 45.5%, total cholesterol 216, triglyceride 118, HDL 36, LDL 153, HA1C 6.30, which says pre-diabetes. I want to start my next blast, including several other drugs, GH and insulin. I'm planning to run a combination of low-dose rosuvastatin and aspirin to restore the lipids. What is your thought on this? And as the HA1C says, I am pre-diabetic. Is that reversible? Should I take metformin for this? How long should I wait for my next blast, or should I continue my cruise? So I guess let's start with this
It's a
question.
lot of things, and it's an interesting question. And this guy has to rethink about starting because he's in a bad shape, actually. So number one, he has diabetes, and
Wow.
he's young, and it's out of the question to use again GH. At least he has to drop the 6.5 down to 5%, and this takes some time. You have to use metformin, you have to use alpha lipoic acid, chromium bicarbonate, kill the carbs, lots of protein and fiber, good fats, empty stomach cardio, minimize your visceral fat, drop weight also in order for your insulin sensitivity to improve, zero trans fat, minimize saturated fat and refined sugar, of course. And perhaps some IF or keto diet will help, but it's about having energy, to lift the weights. Now, dyslipidemia, he has to use some supplements. Now, if he wants to use statins, he should be aware that statins affect skeletal muscle, and then you're going to suffer from recovery. You're going to feel extremely sore. That will affect the liver afterwards, because the liver elevates the liver enzymes when you have rhabdomyolysis. There are common receptors, okay? There's restraint. And so he can use some statins, but of course, no steroids along with statins, because also steroids elevate the liver enzymes. And also steroids push you to train harder, and then statins already strain muscles, so it's a messed up situation. But he can use some red rice yeast, some polycosanol, resveratrol, phytosterols, krill oil. To lower his LDL below 100, he has to use some niacin and daily cardio to elevate his HDL over 40 and drop his total cholesterol below 200, and some krill oil or fish oil to lower his triglycerides below 150. And what else? The first one was PVC, I think.
So let's see. PVC was 45.5.
Yeah. Now
I'm sorry, PCV.
45.5.
Yeah.
This sounds like hematocrit. I don't know.
Okay, I don't know what that is.
Anyway, yeah, so he has to wait a little bit. I think he has to wait at least between 4 and 8 weeks in order to get into another cycle. Do not touch pills again, because pills strain the liver and the lipids more than injectables. Yeah. Okay, and take it easy. Follow a healthy lifestyle for 2 months.
Yeah, diabetes is always a bad thing to have, but right now with COVID, I did an interview a couple weeks ago with the ICU nurse in Florida who's been dealing with COVID patients for these last 4 months. And he says they seem to have, aside from very older people, it's diabetics that are having the highest death rates that he's seen. People that aren't making it that get COVID. So
diabetes, usually type 2 are obese people, Obesity also gives you blood pressure and the metabolic syndrome, of course, more cytokines, inflammatory cytokines released from this gut, It's a circle.
Right. Okay. Speaking of orals, we just talked about, is Anadrol the best bulking oral? What are the most common side effects, and what are the best doses? Is it true Anadrol makes you go bald really easily due to its androgenic effects, or is it not that androgenic at all? Anadrol.
So Anadrol is a DHT derivative that's supposed not to aromatize, but the metabolites of oxymethylone have high affinity for estrogens. So if you use it alone, but nobody use it only in medicine, usually shouldn't aromatize. But when you combine it with aromatizing compounds like testosterone, deca, equipoise maybe, and then you notice gynecomastia. Of course, Anadrol gives you tremendous pump and this jacked feeling, because it increases the glycogen synthesis, and the water retention is responsible for that. And also estrogens play a role in estrogens are based also on water retention, and this is a fundamental way how glycogen is synthesized by carbs and water, So that's why with elevated estrogens and with Anadrol also, but also, yes, the androgenicity also is responsible for this glycogen synthesis and retention is why it makes you this pump, the 3D. That somebody told us use Anadrol the last 4 weeks and the last month before the show in order not to lose, the pump. And they developed this bluish purple phase after the set because of the elevated hematocrit,
Yeah.
But Anadrol is responsible for hair thinning because it's DHT derivative, and I think it has some androgenicity that is responsible also for this, and also the glycogen retention. I think it may give you acne also as all the DHT derivatives. And it has a short half-life that it needs to be used 3 times a day.
Wow.
But Anadrol, I think the old-fashioned Anadrol from the States and Greece was having anasterone, which was oxymethylone pharmaceutical grade. It gives you a hard time to eat and digest, so you can have many meals.
Yeah.
I've heard people use up to 150, so 3 pills a day. I've heard that an Olympic competitor and an Arnold Classic winner used 12 Anadrol a day.
Yeah. Crazy. That's insane.
I'm not sure if this possible.
I hope that's like a myth. I hope that's an exaggeration. 12 Anadrol a day would be 600 milligrams of Anadrol a day. That's a lot. That's a lot. His liver must not have been very happy at all. Man, okay. Wow, well, we get acne questions all the time, but this is a little different, I guess. What do you think is the reason for the terrible acne that people suffer from post-cycle? My friend had no acne while he was on, but his chest and shoulders flared up like crazy as soon as he came off. How does one treat and prevent this?
I think it's the result of hormonal imbalances, androgens fall, then estrogens rise. But also if you use aromatase inhibitors after, then when you block estrogens by an aromatase inhibitor, mainly, not by SERMs, you elevate the other metabolite of testosterone, which is DHT, and is responsible for acne. That's why when you take sometimes letrozole or anastrozole or exemestane, you elevate some hair thinning and some acne. You break it out because indirectly you elevate your DHT. So on the other hand, if you take some anti-androgens for prostate enlargement or for hair thinning, like 5-HT reductase inhibitors like Propecia, for instance, or Avodart, then you look smoother and you feel castrated because your DHT cuts down and your female hormone estrogen elevates. And I think it's about imbalances. So if you're trying to block the estrogens after because they elevate with HCG, if you want to lower them, indirectly you elevate your DHT, which is responsible for that. And personally, yes, I have also noticed that after the PCT or during the PCT and after the end of a cycle, I was breaking out. Now, notice that also HCG itself elevates some testosterone that will convert to DHT. So it's multifactorial, And you have to then use locally azelaic acid, clindamycin lotion, UV radiation, ultraviolet, artificial tanning beds, and also salt, seawater, which is hypertonic. Also, it's good for these spots, And of course, Accutane if it's cystic acne in trees, or you can use some antibiotics, some amoxicillin per us.
Fair enough. Okay. And our final question, also about Anadrol. How stressful on the liver would it be taking 25 milligrams Anadrol every other day for 6 weeks? And would it still produce decent strength gains? Also, would taking 600 milligrams a day of NAC reduce the effectiveness of the Anadrol? 25 milligrams of Anadrol just every other day. That doesn't seem very effective to me. What about you?
It's like taking 53 times a week, eh?
Yeah. You would only get 50.
200.
You'd get like 75, something like 75 to 90 milligrams for the whole week.
I'm sorry, 150 a week.
No, he only wants to take 25 milligrams every other day. So
it's like taking 50 milligrams 3 times a week.
No, this would only come out to, so every other day, if he's doing it like Monday, Wednesday,
So
Friday.
100 grams, huh? It's
Yeah,
not
it's
a
not
lot.
much. It's not much.
I think he should take at least half of it the day of the workout,
Mm,
just for the workout sublingually.
yeah. But wouldn't you want to take it every day at least? A little bit every
Yes,
day?
yes. Yeah, and non-training days to keep an anabolic environment, but absolutely the training days, you need them, the pills.
Okay. And what about NAC?
NAC, yes, NAC, it's good for glutathione synthesis if he cannot find some glutathione, but also he can introduce some milk thistle, that also it's an antioxidant for the liver and produces itself the liver glutathione under milk thistle or silymarin supplementation. Okay.
Would NAC make the Anadrol less effective or no?
I don't think so, no.
Okay.
I'm sorry. I mean, in this theory, a damaged liver would be more effective. I mean, um, liver deactivates every kind of substance that enters the system. Okay.
Hmm.
The point with 17-alkylate that they are covered by this methylation that prevents the liver to break them down, and this is what strains the liver during the process of deactivating those substances.
Gotcha.
But I don't think that a healthy liver will have a negative effect on those substances. No, you need a healthy liver in order to be a more productive bodybuilder.
Yeah. I mean,
You don't need jaundice. You don't need liver disease. You don't need cholestasis to say that I'm a powerhouse.
Yeah. I mean, once your liver goes, you're done. I've lost a sister to liver disease. It's a terrible way to die. I don't know why I
It's
brought that
a
up.
chemical. It's a biochemical factory.
Yeah.
It has high rate of rejuvenation, but when you have liver disease, then everything goes down.
Yeah. Bad news. Well, Doc, that is all our questions for this week here in America, where we were opening up, and now it looks like we might have to shut back down again. I don't know. Things are getting bad. It's getting bad. I knew it was going to happen. I mean, once you open up, of course, the cases were going to have to surge again, but I don't know. We'll figure it out somehow eventually. Anyway, wish you the best over there in Greece. I hope you guys are all doing well.
So
And
this week, are you training in the gym?
no, we're not back yet. No, hopefully 1 week from today, my gym opens up. Hopefully, but there's no guarantee. There's no guarantee. Still training at home. Got my weights. Better, much better than nothing. I'm not complaining, but I want to get back to the gym. I love the gym. Yeah.
Yeah.
Cool. All right, doctor. Thank you so much. I want to encourage everyone. Every Tuesday is Dr. T Tuesdays on musculardevelopment.com. New article by Dr. Tuliados posted. What are we talking about tomorrow, doctor?
It's keto diet, So
Keto
it's
diet.
my nutrition and my training articles now. I run out of drug articles. I wrote about 30 of them.
That's enough. That's enough, don't you think? I mean, training and nutrition are equally important, as we try to stress.
Yes.
But people just want to hear about drugs.
Well,
So
they don't know. They don't know how to use drugs, and they don't know already how to eat and how to train. This is crazy.
yeah, I mean, if you don't have any muscle at all yet, guys, train and eat for a little while. Get some
Drugs
muscle.
do not work without proper nutrition, without proper training. They're not so effective.
They're not miracles. They're really not. They help a lot, but they're not a miracle that you can just go, please, drugs, and you
And then you
explode
blame the
muscle.
drugs for not being effective, and for being faked.
Right. So I want to let everyone know, if you have questions for the doctor, please leave them in the comments here below in the YouTube video. And we look at those all week and we collect them for the next week. And that's when Dr. Tuliados answers the question. So please leave them here. We'll get to them. And that's it. Thank you all for watching. Please check out his book. And the Amazon.com has the previous book.
Next week, I'm going to have the new one, and we'll travel to you.
Oh, awesome. Yeah, I can't wait to see that one. That's going to be cool because I've already read this one like twice. I need a new book. Cool. Well, thank you, doctor. Thank you so much for your time, your expertise, your knowledge. And thanks, everybody, for watching. Please subscribe. Please hit the bell for notifications. Appreciate your viewership, and we'll see you next time.